Why do COPD wheezing sounds improve with bronchodilators? Imagine trying to breathe through a straw that's partly squeezed shut. That's what wheezing in chronic obstructive pulmonary disease feels like. When airways narrow, airflow becomes turbulent, creating those high-pitched sounds. But why do these sounds get better after using certain medicines? Let's find out. In COPD, the airways become tight because of inflammation, excess mucus, and muscles tightening around the tubes. This narrowing makes it harder for air to pass through smoothly. When you breathe in or out, the airflow hits these constricted areas, causing the wheezing sound. Think of it like a garden hose with a kink. Less water flows and it makes a noise. Bronchodilators are medicines that relax the muscles around the airways. They work by targeting specific receptors in the airway muscles. Some stimulate beta to adrenergic receptors, which cause the muscles to relax. Others block muscarinic receptors, which normally cause muscles to tighten. When these muscles relax, the airways widen or dilate. As the airways open up, airflow becomes smoother and less turbulent. This means less resistance and fewer wheezing sounds. It's like straightening that kinked garden hose. Water flows freely again. Plus, when the airways are wider, mucus can move out more easily, reducing blockages that also cause wheezing. Most bronchodilators come in inhalers or nebulizers, which deliver the medicine directly into the lungs. You'll notice the wheezing improves pretty quickly after inhalation because the muscles relax fast. Short-acting bronchodilators give quick relief, while long-acting ones help control symptoms over time. So, in simple terms, bronchodilators help improve wheezing in COPD by relaxing the tight muscles around your airways. This widens the passages, allowing air to flow more easily and reducing the sounds of wheezing. They also help clear mucus, making breathing smoother overall. That's why many people notice their wheezing sounds decrease soon after using these medicines.